If you're someone who's having irregular periods and weight gain and sexual changes and it hurts to have sex, or your libido's changing, or you've all of a sudden become metabolically resistant or insulin resistant, you can start this process earlier. And in fact, we're seeing a lot of women who start this earlier than 45, but technically, historically, perimenopause starts at 45. And what can happen is you see changes in your cycles. You still have them, but maybe you don't ovulate every month. Maybe you ovulate twice a month. So this is a time characterized by either too frequent or too infrequent, or maybe a mix of both of them. In both perimenopause and menopause, you can have sleep disruptions, mood changes, weight changes. Your gut can function differently. You can have hot flashes. You can have chills. You can have night sweats. You can become insulin resistant. You can have changes in your libido or your response. And it can also become uncomfortable to have sex. You can see that in both perimenopause and menopause. And menopause occurs for most women between the ages of 51 and 52. Again, it's an average. I have a ton of patients in my practice who have completed menopause and they're 47 years old, 48 years old. But it tends to be around 50 to 52. And menopause is actually defined by not having had a period in a year. So you're officially menopausal from the date of your last period if it's been more than a year. Now, the things that you can see in menopause are bone loss. You know, everyone's worried about their bones, but you can also see cardiovascular changes. Our cholesterol tends to increase in the menopausal period. And we can also see pain with intercourse because as estrogen goes down, the tissue, think of your vagina as like a tissue that has a rubber band. And as you get more into menopause, it gets less elastic and it can be uncomfortable.